Winnipeg police have made a significant drug bust for illegal drugs. 9 kilograms of methamphetamine and 4 kilos of cocaine were taken off the streets. Here's the story.
Police Service Guns and Gangs Unit began an investigation into an illegal drug distribution operation within Winnipeg. The extensive investigation led to a Control of Drugs and Substance Act search warrant being issued on April 16, 2020 for an apartment suite located in the 2200 block of Pembina Highway, as well as an apartment suite located in the South Pointe neighbourhood. Numerous units assisted in the execution of the warrants, including Drug Enforcement Unit, East District Community Support, and the Tactical Support Team. On April 16th, officers stopped a vehicle on St. Mary's Road with 2 male suspects associated with both of those noted addresses. The males were arrested, and a subsequent search of the Pembina Highway apartment located the following: 9 kilograms of methamphetamine with an estimated street value of $1.8 million, 9 kilograms of cocaine, estimated street value $400,000, 326 grams of ecstasy, estimated street value $3,500, half a kilogram of benzocaine, which is a cutting agent with an estimated street value of $2,500, as well as $5,895 in Canadian currency, a ballistic vest, or a bulletproof vest as it's often referred to, and a money counter. James Daniel Perlay, 43, has been charged with possession of a scheduled substance for the purpose of trafficking, methamphetamine, as well as trafficking charges relating to cocaine and ecstasy, possession of proceeds of crime over $5,000, possession of body armor without a permit. He was detained in custody. Second individual, Biniam Fitur, 40, has been charged with identical charges: possession of a scheduled substance for the purpose of trafficking, methamphetamine, as well as trafficking charges for cocaine, ecstasy, possession of proceeds of crime over $5,000, and possession of body armor without a permit. He was also detained in custody. We have with us Inspector Max Waddell, and he has a number of exhibits here which he'll be discussing, and he will take questions. Inspector.
Thanks, Rob. Good morning, everyone. I'm going to have a few opening comments, and then I'll get into more details of the investigation. But let me just start off by saying that the result of this investigation is significant, not only for the police service, but for our community. The sheer volume of methamphetamine and cocaine that you see before you, with the estimated street value of $2.2 million, it really had a large potential to spread significant impact amongst us all. And since this pandemic has impacted our community, we've seen increases in the base price of methamphetamine, increasing from $10,000 a kilo to $20,000. Similarly, cocaine has also increased from a base price of about $60,000 to $72,000 a kilo. This all relates to the cycle of supply and demand, which I'll talk about later. Often we talk about where is the methamphetamine coming from. It's still our belief that a large portion comes from the Mexican drug cartels. They are currently challenged right now that a lot of precursors that they have to obtain to manufacture is being restricted due to the pandemic across the world, and therefore you're seeing these increases around the cycle of supply and demand. The methamphetamine also being sold at 0.10 of a gram. When you do the math on that, has the potential to impact over 90,000 individuals in the city of Winnipeg. We know how highly addictive methamphetamine is, and that would put a massive health strain on all of our systems that are currently in place. And lastly with that, I will take any questions that the media may have. Know that this matter is before the courts, and I therefore have to be guarded in all of my answers. So please go ahead when you're ready.
Okay, we're starting with CJOB.
Good afternoon, Diana with 680 CJOB. Inspector Waddell, is there any indication where these drugs came from?
As I indicated, the major supplier for methamphetamine is Mexico, and cocaine typically originates in countries like Colombia, where there's access to the coca leaf that it's manufactured from. That, of course, is still under investigation, and that's really our best knowledge at this point in time.
Okay, and then as a follow-up, I know we have been cautioned not to look too much into how the pandemic is affecting crime. You kind of did touch on it in your opening remarks as far as how the prices have gone up due to constraints on whatnot. Anecdotally, are you able to say if there's been any kind of change in what officers are seeing in terms of drug-related arrests or incidents? Obviously, this is a very significant bust. What are you finding in terms of drug-related crime these days, if you're able to say?
Well, let me start off by answering your question to say that addictions is so very powerful that we have not seen any decrease in the amount of illicit drugs that are getting into the hands of those who are A, trafficking it, and B, using it. All we're really seeing is the increase of pricing in it because more people being at home, etc., are wanting it and needing it. And the pressures of the pandemic, I think, have probably also impacted the addiction cycle. As far as drug-related crime goes, with less people being out in the street, I can tell you in the last 6 weeks, we've had some of the most significant busts we've had. If you recall, just over a month ago, too, we had another seizure of over 19 kilos of cocaine. So in some ways, it's actually assisting us in identifying these individuals.
Okay, CTV?
Hi, David McKendrick with CTV. I'm just kind of wondering, you did touch on it briefly, but what kind of impact will this have on the current drug trade then?
Well, specifically with this investigation, it is going to take this out of the hands of individuals who were trafficking it. And we all know the impacts of methamphetamine on how highly addictive it is and all the, I guess, circumstantial crime that goes with methamphetamine. I mean, we see car break-ins, we see break-and-enters, we see vandalism, we see all those other things for the totality of what the drug trade does. So when you can remove this quantity, as I said, it had the potential to go to 90,000 individuals. It has to have an impact.
And as a follow-up, but just also, if you want to touch a little bit on how concerning this is to get something that's substantial.
Well, I don't think it's any secret. There is a serious drug problem in not only Winnipeg, but the entirety of Canada. And I think we've been trying to educate not only the media, but the public about that. And we have sounded the alarm bells for years. And that's why it's important we all work together in partnership, not only from law enforcement to health and government, to make sure that these individuals who are trafficking are going to be held accountable. And I can tell you in this case, they absolutely will be.
Global?
Hey, Joe Scarpelli from Global here. Would you be able to talk at all about a potential criminal history that the suspects might have?
Unfortunately, I cannot comment any further on that at this time. Just as, again, I had stated earlier, this matter is before the courts.
And just to back on the COVID-related challenges, with the borders being closed, so are you anticipating or seeing any new ways that suppliers are trying to get drugs into the city?
Well, most certainly one of the causes for the increase in price, especially with the American-Canadian border essentially having tighter restrictions, we are being advised that it is more difficult to get illicit drugs into Canada. But as I've also stated many times before, drug dealers exist and are successful for certain reasons, such as their ingenuity in finding new ways. And we know how many routes and availabilities to move drugs there are, whether it be through train, through motor vehicle, you name it. They're just looking for other routes, and clearly by the amount that's in front of me here today, they found ways to get it here.
Radio Canada?
Yeah, hi, this is Chloe from Radio Canada. I think you talked about that, but the sound was really low on my phone. I must have a problem. So do we actually see an impact of this pandemic on criminality? Like, do you see fewer crimes?
I'm sorry, I didn't hear what else.
Can you repeat that, please, Chloe?
Yeah, sure. So I was wondering, I think you talked about that, but I just want it to be clear. So you see fewer crimes now because of the pandemic, because people are stuck at home?
You know, some crimes are down for sure. I don't have specifics. I mean, people being at home, I think it would only make sense to think that there's less residential crime happening at residences as far as break-and-enters, etc. occur. But as far as the drug trade goes, we're not seeing any indication that it has slowed down. And again, that's all around the cycle of addiction that requires it to continue.
Okay, thanks. I don't have any follow-up questions.
Okay, Free Press?
Hi, I'm Lauren from the Free Press. So the investigation is ongoing. Do police anticipate any further arrests based on the specific or around the specific bust?
We do not expect any further arrests at this time.
Okay. And as a follow-up question, this is at least, like I may be missing others, but this is at least the second huge illicit cocaine bust in less than 2 months in Winnipeg. Are police and investigators noticing a specific jump in cocaine trafficking in Winnipeg specifically?
If you were to look at seizures across Canada, my understanding is that it is going up across the country. Again, it could be just a preference for individuals. We know with the use of methamphetamine, the toxins that go within it, it's a much harsher drug and it's a much different high. I think really it's a combination of availability versus what I talked about earlier, the difficulty in getting the precursors to manufacture meth, and the fact that cocaine is much easier on the system and it's more available.
Okay, are there any follow-up questions at this point? Please identify yourself and ask your question. Hearing none, thank you for calling in today and have a good day.
Okay.
If you found this video helpful, hit that subscribe button, hit that like button, share this video, and keep up to date